Good morning, everyone. So, after a long period of time, I'm again putting my video on the topic Introduction to Experimental Pharmacology. In this video, I will discuss with you about the toxicity studies. It is acute toxicity studies, which is occurs in the animals. It is preclinical toxicity studies. I will discuss basically in this Introduction to Experimental Pharmacology. And before I start my video, I want to request you if you like this video and if it is helpful to you and if it's useful to you, kindly subscribe to my YouTube channel. That is Dr. Nitika Pharmacology Discussion. Thank you. Now I'm starting my video. So first of all, what is definition? Definition, as you know, of the experimental pharmacology is the practical science which deals with the elucidation of drug effect in living tissue, that is in vitro and in vivo experiments. That is experimental pharmacology, that is the field in which the experiments are done on the animals. We see the effect of the drugs on various animals like rodents and non-rodents, in vivo or in vitro. In vivo is when we use the in the living human in the living animal body when we conduct the experiment, that is in vivo experiment. In vitro is from the outside tissue culture or any organ which is outside of the animal body. In vitro experiments can be occurred in the artificial medium. So, what are the experiments basically done is like on dogs, we see the effect of adrenaline or noradrenaline or isoprenyline or histamine or of the effect of the blood pressure or heart rate on the dog, on the anesthetized dog. We can see the effect of the isolated frog's heart, effect on the heart rate of the adrenaline or acetylcholine. We can see the effect of the uh, acetylcholine or adrenaline on the rabbit ileum. We can see the effect of the meiotics or midriatics such as pilocarpine, physostigmine, phenylephrine, etopen on rabbit's eye. Because these are various experiments which can be which occur in the experimental pharmacology, which we can do on the animals. So objective is very important step in drug discovery. It is very important step when the drug discovery process is there. This is the second step in the drug discovery process, that is the preclinical toxicity study, which is done to know the safety and risk evaluation. Safety means how much is the drug is safer. To check for it, we use the acute toxicity studies to know the safety of the drug, and risk evaluation, that is risk benefit ratio, is evaluated. Preclinical toxicology data of a drug is evaluated before it enters the human clinical trials. In this, we give the dose of the drug is given in high doses to see if that dose is toxic to the animals or not. And if that dose is toxic to the animals, this produces harmful effects in the animals. So that drug is considered hazardous to be used in the humans. But it is not used in the humans in the normal usage. Like if it is more toxic to the animals in the high doses. In low doses, the animals risk benefit ratio is assessed in the humans. So preclinical testing of the drug in animal is important to evaluate. Now, first is the safety or toxicity of the drug. Then we have to evaluate the preclinical. We have to evaluate the pharmacokinetics, that is the what the body does to the drug. That is pharmacokinetics. It is absorption, distribution, metabolism, and excretion of the drug is studied in this preclinical toxicity study testing. Pharmacodynamics, that is effect of drug on the body, what is efficacy, what is potency of the drug, and toxic properties. Toxic properties means how much is the drug is safer to be used in the humans. In several species of animal models, animal models can be rodents and non-rodents, and these are selected on the basis of the uh, uh, criteria that the animal which resemble the human characteristics is tested for the drug is taken as the uh, specimen is taken as the species for the effect, so see the effect of drugs in the animals, like if it resembles a human characteristics, uh, and so that extrapolation is reliable and reproducible. Means if it resembles in anatomy, in physiology, in biochemistry to the humans, whichever animal, then that is selected so that the result is reliable and reproducible. So types of experiments. So these can be qualitative experiment or quantitative. Qualitative means when we know the effect of the drug, we know the pharmacokinetic of the drug, we know the pharmacodynamics of the drug, we know the safety of the drug, potency of the drug. Quantitative means when we do the bioassay, when we look for the potency of the drug, or we know for the, or we calculate the unknown concentration effect of the test drug. Within the animals, we do the experiments. We divide the animals in two groups, that is the test group and the control group. In the control group, we give the vehicle or normal saline. In test group, we give the drug whose effect has to be seen. And then when we give the test drug, we have to note for the potency and the quantity of the unknown concentration of the drug. So bioassay is done. That is the quantitative experiment. So qualitative is to analyze the effectivity, means what is the drug effect, what is the therapeutic response of the chemical or the drug, which is the action of test drug may be modified by other drug. Like in the dog's PP, when we see the effect of the blood pressure on the dog, effect of the adrenaline on the blood pressure in the dog. First, there is when we give the adrenaline, there will be stimulation of alpha 1 receptors and beta 1 receptors, and there will be rise in BP. And then at the low doses of the adrenaline, there is stimulation of beta 2 receptors and there is vasodilatation. So that will lead to fall in BP. Means there is biphasic response of the BP. First of all, rise and then there is fall. Biphasic response is seen when we give the adrenaline. Now, when we give after adrenaline, we give the prazosin or pentolamine, which is alpha blocker. It will block the alpha 1 receptors and only beta 2 receptors will be stimulated then. So, there will be fall in BP. So, this is the effect of the one drug which may be modified by the other drug. Found to be active in a particular manner. Means first by the adrenaline there was a biphasic response, and when we give prazosin or pentolamine, there is fall in BP due to beta 2 receptor stimulation. Quantitative is to design the assay to assay the activity of the drug, that is to estimate the amount. Means what is the amount of the unknown concentration of the test drug in a solution of a plant or animal extract. So, toxicological studies, what are these? The toxicity studies in animals, when properly qualified, applies to toxicity in the human beings. Is how when we give the doses, higher doses in the animals of the drug, and if it is found to be toxic, so now it is considered hazardous to be used in the humans who are exposed in the low doses of the same drug. This exposure of the experimental animals to the agents in high doses is necessary and valid method to discover the possible hazards to human beings who are exposed to much lower doses. So, preclinical toxicity studies, these can be divided into acute toxicity study, subacute toxicity study, chronic toxicity study, and other special tests can be reproductive evaluation, mutagenicity study, and carcinogenicity. So first of all is acute toxicity study. This is the single dose study, and this is done to determine the LD50, that is lethal dose 50, that is the dose which produces lethality, or which is lethal to almost 50% of the test group animals. And this is determined how we give a single dose study. Single dose is given by two various routes, and first one which has to be given is the IV. IV is the uh, most important route which can be given. The drug can be given IV bolus or IV infusion, because this is the most common route to be used in the humans, IV. And other route can be oral, subcutaneous, intraperitoneal can be there. And out of the two routes, one route intended for use is subsequently in the humans. One is intended route for use subsequently in the humans, and that is the IV. Aim of this test is to establish a therapeutic index. Means we acute toxicity studies done to know the LD50, and on the other hand, the therapeutic index, that is the LD50 over ED50. ED50 is effective dose, which is effective in 50% of the animals, that is, which is produces the effective therapeutic response in 50% of the animals, that is the ED50. And LD50 or ED50 is the therapeutic index, and greater will be the index, that safer will be the drug. Means more will be the index, safer will be the drug. So subacute toxicity study, this is the daily dose test. Means इसमें क्या होता है कि we give the drugs in the greater doses. Means in the first the low dose is given, then a bit of after certain period of time, every 2 to 3 days, increasing stepwise, we give the increasing doses of the drug are given. ठीक है, dose daily starting at therapeutic levels, increasing stepwise every 2 to 3 days. Until when? Until the toxic signs and symptoms are observed. This dose is maintained for 2 to 3 weeks. We now acute toxicity study is done for a period of 2 weeks, and subacute toxicity study is done for a period of 2 weeks to 6 months. So we just know for the graded doses the drugs are given, and we know for the pathological changes in the animals. We can also look for the hematological. Hematological means what is the change in the cholesterol level. This cholesterol, triglyceride, LDL, HDL, VLDL, biochemical monitoring. Hematological means what is the change in the liver function test. It is AST, LDH, ALT, STH, in the indirect bilirubin, in the direct bilirubin, and in the urea creatinine, in the kidney function tests like urea nitrogen creatinine, and in the kidney function tests like what is the level of the potassium, what is the level of the calcium, in the pancreatic enzymes like lipase and amylase, what is the quantity of amylase and lipase in the body. So these biochemical tests can be done to is carried out to know, and we can also know the histopathological examination can also be done. The animals can be sacrificed, and then histopathological examination can be done in the subacute toxicity study. So, what is the aim of the subacute toxicity test is to determine the maximum tolerated dose. Maximum tolerated doses, that is the dose which is produced, which produces the maximum therapeutic response, and which doesn't produce any toxic effect, and to indicate the nature of the toxic reaction. Maximum tolerated dose, as well as to indicate the nature of toxic reaction, we do the subacute toxicity study. So chronic toxicity, these are the tests in which two species of animals are taken. Means one is rodent and another is non-rodent. Rodent will be rat or mice, non-rodent will be dog, monkey, baboons. So ये हम लेते हैं, and animals are dosed daily for 6 months. This is a test which is done for a period of 6 months to 2 years. We do give the doses and graded doses in the animals, and here the doses are given in low, medium, or high dose. Low is what? Low is the therapeutic dose, twice the therapeutic dose. And it is the dose which doesn't produce any observable toxicity in the animals. High dose is the 10 times of the therapeutic dose, which produces a toxic effect which is observable in the animals. And medium is the intermediate between low and high, and it produces a bit of the signs of clinical signs and symptoms of toxicity in the animals, not the full toxicity is not seen. So all the vital parameters, hepatic means liver function test, renal function test, blood levels, what are the cholesterol, triglycerides, HDL, LDL levels, these are tested, and the animals are sacrificed, and vital organs can be subjected for histopathological examination. And this is the study which is done to evaluate the full and long-term potential, toxic potential of the compound. To test for the long-term, full and long-term toxic potential of the compound, we do the chronic toxicity studies. So reproductive test, what is it? It is the if the drug is intended to be used in women of childbearing age, Its effect on fertility and teratogenic potential must be investigated. Means if the drug is intended to be used in women of childbearing age group, now what is the effect of the drug on fertility? Whether it affects the fertility of the female, or whether it produces any teratogenic potential in pregnancy of the female, that can be investigated by this reproductive test. Mutagenicity studies, mutations can occur between the mutagenic agent, which is the drug, and the genetic material of the organism. So that can lead to production of various diseases in the animals. So we can look for we can see for the effect of the uh, various drugs on these animals, on which we induce the uh, diseases by changing the genetic material of the animals. So this can be done in vitro or in vivo, involving bacteria, yeast, insects, mammalian cell culture, and animal organs. Carcinogenicity tests, malignant and benign tumor can occur spontaneously or induced by drug and chemicals which are studied in different animal models. Means when we give the drug to any different animal model like rat or mice, the malignant and benign tumors can occur spontaneously or they can be induced by the drug. Like urinary bladder cancer are studied in the dogs. In the dogs, there can be development of the urinary bladder cancer because of some drug. So we can see the effect of various anti-carcinogenic drugs, anti-cancer drugs in the dogs. So types of experimental setups, these are perfusion, infusion, superfusion, and transfusion. Now perfusion is when there is one inlet of the drug fluid which contains the drug solution, and one outlet. That is experiment of the frog's perfused heart, in which the inlet of the fluid is sinus venosus and the outlet of the fluid is truncus arteriosus. So this is the experiment of the frog's perfused heart. So infusion is when there's one inlet, like in intravenous fluid, there's only one inlet and there's no outlet. The drug, it reaches the body, or it remains in the body of the animal. It has no outlet. So this is intravenous fluid. Superfusion is when one animal serve as the inlet for the when outlet of one animal serve as the inlet of the other animal. This is autolury in his clinical experiment demonstrated, like vagus nerve stimulation. What will do? It will lead to fall in the blood pressure or in the heart rate of the perfused frog's heart. When vagus nerve was stimulated, a substance which was vagus stuff, it was released, and it also slowed down the second frog's heart, and there was no connection between the first frog heart and the second frog heart. Now, when there was vagal stimulation of the first frog and the vagus stuff was released, and there was also slowing of the second frog, and there was no connection between the second frog and the first frog. So, this was the experiment conducted by autolury superfusion, when outlet of one animal serve as the inlet for the other animal. So, transfusion, what is it? It is the just similar to infusion, means in which there is one inlet and no outlet, and the fluid remains in the body of the animal, and the fluid in this case is the blood and the blood products. That is blood transfusion or that of the plasma. So this is the transfusion. So That's all with my video on the introduction to experimental pharmacology, in which I discuss with you on the preclinical toxicity studies basically. So that's all. Be happy, be blessed, stay safe, happy learning. All the very best. Thank you.